I'm surprised immediately by the fact that your training was purely an abdominal ultrasound. So how long is that training?
Well, formally a year to do your postgraduate certificate, but I've done ultrasound training for a number of years, but I didn't get my certificate until the year 2020.
Okay.
So I wasn't able to get a formal qualification. It's very difficult to, it was difficult years ago to get qualifications, but as training changed and the AECC down in Bournemouth started to offer it, there are quite a few practitioners who use ultrasound in the musculoskeletal field. So that's where 99.99% of practitioners have done their training. And if people are watching this thinking, oh, I want to do that, I would really recommend they start off doing MSK training, because it's not going to ruffle any feathers. It's not terribly controversial. Doing abdominal ultrasound out in clinical practice is controversial, and we'll probably talk about that a bit later. But if you want to go down this route, do some MSK ultrasound, because you're going to get good experience. It's going to set you up nicely to do your abdominal training. Right. I think I'm the only chiropractor that has an abdominal ultrasound certificate, as far as I know. So it's pretty unusual, and that's both a good and a bad thing, because when you're unusual, then people think it can't be possible.
Yeah, and so when you say MSK ultrasound, is that, to do a course in MSK ultrasound, does that mean you're going to cover the whole body? So you'd be able to identify tendons down there and ligaments up here? And
depending on how many modules you do, yes, okay. Absolutely, yeah. So you might be able to diagnose a muscle tear, or you might be able to diagnose a tendinopathy. You might be able to diagnose an inflammatory arthropathy. MSK's got. I mean, you can even diagnose fractures with ultrasound. I mean, it's really helpful. I mean, I used my machine here to diagnose a fifth metatarsal fracture on a patient that came in, nice and easy. She developed this lateral foot pain. We ran the scanner using a high frequency probe, different to this one, along the fifth metatarsal, and you could see a break in the cortex. And so it was like, well, you've broken it, so you need to go and get an X-ray. So MSK is really, really helpful. I never did my MSK certificate. I went straight into doing abdominal, because that's really where my passion is. But no, if people are interested, start with MSK, and if you can get yourself onto an abdo course, then that's great.